everyone. Welcome to our About Face and IWK panel presentation. I'm joined today by some of our facial difference community members, as well as some IWK staff. Um, we're just gonna kind of get right into it. So I'm joined by Raylene and Kendra Ann from the IWK, as well as Morgan, Sophie, and Sarah from the Facial Difference community. Thank you, everyone, for being here. Really appreciate it. Really appreciate your time. Um, so, before we get into the panel with the Facial Difference community members, I'm going to let everyone introduce themselves. Um, so we'll start with Morgan and then Sophie and then Sarah. Just a little bit about you and why you're here today. So Morgan, go ahead.
Hi everyone, my name is Morgan Lacusta. I'm 30 years old and I'm from Calgary, Alberta. That's where I live here, so it's a nice sunny day. And so I work for the government of Alberta's income support program, and I'm here today as a lady with Cruise-on syndrome. I'm here to support AboutFace and have an opportunity to extend my experiences and knowledge across Canada and meet some cool people with IWK. And yeah, I'm excited to be here because you'll hear more about it probably later, but I'm just really a big advocate about giving back in those resources and those supports that I never had as a child and adolescent. And just even for parents, I think, of children with facial differences, I think I'm here to speak on their behalf as well. So I'm just really excited to be here.
Amazing. Thanks, Morgan. Sophie, go ahead.
All right, my name is Sophie Ormond. I am 16 years old. I like musical theater. I'm here as a person with cranial-frontal nasal dysplasia. Ooh, that's a mouthful. Um, and I'm here to educate people on the condition because like when I grew up, I did not know the name of my condition. I just called it facial condition. Still bullied for it regardless of not knowing the name, but like, yeah, trauma bonding. Let's go.
Love it. Amazing. Thank you, Sophie. I appreciate you being here. Sarah, go ahead.
Hello. Hi, my name is Sarah One. I was born in Brampton, Ontario, Canada, but I'm currently living in Hong Kong. So it is 3 a.m. Hey! And I'm extremely excited to be here. Thank goodness for social media connections. I was born with a unilateral cleft lip and palate, and I'm an educator and an actress. So I'm an advocate for the cleft community, and I've also created films based around my cleft. So part of the reason why I really love these conversations is I love to talk about my facial difference. I'm 37 years old and I didn't get comfortable with it until my 30s. So I love to talk, especially to youth about like, hey, I've been in your shoes kind of thing. So yeah, very happy to be here.
Amazing. Thank you, Sarah. And thank you for being here in the middle of the night. I really appreciate it. Um, I think this is going to be a really amazing conversation. So thank you, the three of you. I really appreciate it. So now we'll kind of jump into the conversation. Um, so can you share about your personal journey and how facial differences, how that's impacted your life? So we started with Ryan, so I'll start with you, Sarah. Yeah, go ahead.
Okay. Let me see. So, growing up, it was really just when I thought about my cleft, my facial difference, it was all medical. So unless I was having a surgery, there was really nothing, I really wasn't like connected to it. And I was very much like, for lack of a better term, in denial about having a difference. I just kind of like got on with it. When people asked me about it, it was usually like a a medical thing. I was like, oh, well, I was born with a cleft and it means I have to have lots of surgeries. That's just kind of how it was. And it really wasn't until I was a teenager till I got introduced to like AboutFace. And I think I posted about this actually. Camp Trailblazers was like the first time that I met like teenagers with facial differences. And it was life-changing for sure to be like, oh, wow, I'm now surrounded by people who just get it. And it was everything. And I think I was part of one of the first like cohorts of Camp Trailblazers, which is wild to think about. And I mean, if if someone were to ask me, hey, what would you say is an experience that a child with a facial difference needs to have? I would say as early as possible, get your child in a group of people with facial differences. You have to, because automatically conversations just start happening and you're automatically friends because there's something that's like, hey, I get you, even if it's just, oh, you know what it's like to go to the hospital so often and that kind of thing, which my friends growing up, they didn't get it. I always thought, I remember, sorry, I'm so long-winded. Okay,
No,
one
no,
last
go
little
ahead.
thing.
No, no.
Just because I remember there was a time in my life where I realized I came to this realization of, wait, not everyone has had an IV. Wait, not everyone has had a major surgery. I didn't get that because growing up is just so common to me that I just assumed everyone did. I just never talked about it. So I remember I must have been like 13, 14 when I realized like, wait, people don't go to the hospital as frequently as I do. And it was very isolating and it sucked. So then I met people who were like, oh, yeah. And it's like, oh, how many surgeries have you had? Oh, I've had 4, I've had 6. I remember there was someone at camp who was like, oh, yeah, I've had 14. And we're like, whoa. And, just one of these things where you just get each other, right? Yeah.
Absolutely. Thank you. Thank you for sharing that, Sarah. I really appreciate it. Sophie, I'll call on you next. Again, question. Can you share a little bit about your personal journey, and how facial difference has impacted your life?
Obviously I was born with this condition, like most people with a facial condition. Growing up, I was kind of like in denial. Like, no, I don't have that because in my school, I was bullied not just by kids, but by teachers who thought I was contagious. But even then, I was like, it took a really bad toll on my mental health. So when I was 10, I got a full facial surgery, eyes, cheeks, nose, everything. And I thought, oh, this was gonna fix me for sure. It didn't. So I was kind of introduced to About Face, and then I was like, wait, there's more people kind of like me. I was in shock, and then still people would continue to bully me. I have voice recording of him saying, um, people are gonna bully you. They're gonna look at your face, and all they're gonna think about is your facial condition. You're never gonna get a job. You're never gonna do this, and like just a lot of bullying in my life. My parents obviously been trying to help me with that, but getting like therapists and everything, but it's still like it hurts. Like, and since I'm still a teenager and still trying to figure out, like, hey, don't listen to what other people say. It's still like a big thing. And now I've been doing musical theater for like 2 years now, and it's really been helping me with self-confidence. I just finished a show. I'm very emotional because my best friends they were leaving that year because it was like their graduating year. They've aged out. I've been talking too much. That's pretty much it. All right.
No, exactly. No, I really appreciate that, and I appreciate you sharing. And that's that's why we do things like this because it really brings people together and makes us realize that we're not alone. And there are other people out there who experience similar things. So I appreciate you sharing that. Morgan, I'll call on you next.
Got emotional for those two, actually. It was just really, my story is a little bit different than everyone's. Yes, I was born with mine, but I wasn't actually diagnosed with Cruzon syndrome till I moved to Calgary. So I was born in Regina, grew up with a small city vibe. Everyone knew everyone. Would go to the grocery store and people would like stare, but like not say anything. And I always just remember like sitting there going, like, what? I don't see this with anybody else. So we moved to Calgary. My parents are from Alberta. And in Saskatchewan, I like had many doctor's appointments, but more so just for like ear tubes because I had trouble hearing. So when we moved to Calgary, that we went to the Children's Hospital to go see Dr. Drummond, who's an ENT. And we walked in, simply just going to meet a cool doctor for my ear tubes. And his nurse walked in the room and said, "Does Morgan see anyone else here at the Children's Hospital?" And my mom was like, "I don't understand what you mean. Like, can we get some abbreviation here?" She said, "Oh, well, she looks slightly different." And so that has led to a long history of medical to discovering at around 11, 12 that I had something called Cruzon syndrome, which like all of us were like, what half the time? Or my Apple Siri corrects it to croutons. So I had no idea. And while we were discovered the Cruzon syndrome, it started to all make sense. The stairs, the bullying. Weirdly enough, Calgary shaped my life, I would say, quite negatively growing up. Um, Even though I was at a world-renowned hospital, I didn't discover AboutFace till I was actually in my second year of university. So hearing Sarah's story about going to Camp Trailblazers, which I've had the opportunity to volunteer at, and this is why I do what I do, because if I had AboutFace in my life when I was like Sophie's age, I would be a lot more confident. I mean, I am now. I've learned to love the condition I have. I don't shut up about it quite often. But it's just like a simple resource sharing could have changed my life and also my parents' life. I'm the first one in my family who has croissants. I call it the lucky lotto winner. um, but they struggled, the parents always tell you, you're beautiful, don't listen to them. Okay, mom and dad, but I'm a 16-year-old in high school, right? So that was hard. I had my group of friends who I would never hold anything against how they treated me, but it was almost like they kind of that empathy versus empathy, like, oh yeah, you're still pretty. Oh, don't listen to what they say. But all these other kids were saying it at like bus stops, people I didn't even know. So growing up here, I'm forever grateful that we were able to go to the children's, but a simple question truly changed my life. I've experienced several interventions to improve physical abilities, mental abilities through facial advancements, neurosurgeries, reconstructive jaw surgery during my high school year, and orthodontic work going on for years. One thing that I probably will talk about later in the medical portion is something like plastic surgery. As for me, I don't have like the cheekbones, so that could help with the orbitals of the eyes. That was not approved in Canada because it's deemed cosmetic surgeries. And so even if you're born with a facial difference, I think candidates like that should be your prime example, something that could have probably changed my life for the better. One thing I always think about too is treat others the way you would like to be treated. And I think as people with facial differences, that's my biggest goal moving forward. Is I've experienced so much negativity, but I wouldn't dare put that on anyone else. So I really try to, by doing stuff like this, just create more of a positive sense of differences and that we're all unique anyway. So it should just be a great sense of belonging. And that's why I do what I do, because we all the three of us here today just get it. So thank you. I'll stop rambling.
No, thanks, Morgan. I appreciate all of you sharing and um, all of our experiences are different, but we as a community do find um a lot of similarities and um a lot of common experiences, which is why I think it's really important to have these conversations. So okay, so moving on, how has your experience with About Face shaped your perspective on facial differences and your journey and living with a facial difference. Um, Sarah, I'll keep the same order. So Sarah, I'll go to you.
Okay. Hi. Oh my gosh, I just want to like sit and like chat with you guys for hours. I have so many questions already. Um, okay. Yeah, I'm also like, how has About Face shaped? I mean, like just exposure. Yeah, exposure. I think it's been really cool seeing what About Face has like been up to. Like I haven't been in Canada. I've lived overseas for 13 years now. So I haven't been even in Canada for a while. But I love seeing just like following even like on social, seeing like the stories, seeing like especially young people sharing. I live for it because it really wasn't, yeah, it wasn't around in that way when I was young. And Morgan, I could not agree more. Same thing, right? I'm like, oh man, if only, right? um but yeah, I gotta go back. I just have a love affair with Camp Trailblazers. Like I really do. I was such a shy kid, so shy. And yet, like when I was at camp, I was like, just like came out of my shell and like walking around like I owned the place and just like beyond confident. I mean, when I tell people now, I'm like, oh, I was so shy. They're like, no, you weren't. And I'm like, it took a while to get here. It really did. But when you're in a place where you just feel safe to have conversations, one thing that um, I've been, I get even like now struggling with, like, um, is, when I talk about like advocacy and stuff, I get people that say, would you have a facial difference? No, you don't. I don't see it. Okay, thank you. I'm not really sure what to say. And also, but I I was born with a cleft lip and palate. I've had this surgery. Like I have experiences that shape me, that color me. Like I still have a lot of like residual guilt about XYZ, and it does have to do with my cleft. And I am a performer and an actor. Like Sophie talking about musical theater, I was like, yes, hey, because like I'm so all about the stage. And when I do film, that has been huge. I know it's like, it's as I'm an adult, I couldn't imagine doing it as a teenager, but film is here, right? So I'm like, oh man, I'm like, what if the director says something? And I started doing it during COVID, so we're wearing masks. I sit in the makeup chair and I take my mask off, and I like my heart starts pounding because I assume someone's going to say something about my cleft. And in my mind, I go, oh, am I strong enough today? Which I hate that my mind goes there, but it happens, right? And 100% of the time, like when I've been in film situations or stage situations and I'm getting my makeup done or something, 100% of the time, the comments on my face are positive. Usually I get, oh, you have nice eyes. Or, oh, you're so beautiful. Or well, one person was like, oh, your face is so slim. And I was like, oh, thank you. But I automatically go, this is what's going to happen. They're going to say, what's that? They're going to rub their nose. I always assume that's going to happen. And I'm not sure if I answered the question. I kind of like veered off a little bit.
No, that was good. That was good. And again, like, you know, answering the question is good, but like having these conversations is more important. So really
Yeah.
appreciate that. I do appreciate that. Really, it's great to hear these experiences because I think we can all relate. Um, Amazing. Thank you, Sarah. Sophie, I'll go to you next. Again, the question, how has your experience with About Face shaped your perspective on facial differences?
All right. I think the first time I was ever introduced to About Face, I can't remember exactly what the like event was, but my all I remember there was like a big like meeting or whatever. My mom was sitting in the chair and like a bunch of kids all went to this one room, all introduced ourselves. I think I got my first crystal for some reason. It's on my wall. Ever since then I was like, oh, okay, cool about faith. And just this year, Kelsey, I know you know this, the uh commercial, which I think has changed my life. Like, cause like now I'm like really confident, like seeing myself on screen. Because obviously I've been doing stage acting for like 2 years. Still kind of self-conscious about that. I just finished a show, like I said earlier. But I went to my principal's office around a few weeks ago and I asked her, hey, can I talk about faith in front of the entire school with the commercial?
Thank you. Okay, Morgan, I will move along to you.
Okay. Um, so how I found out about Face, weirdly enough, I was on Facebook scrolling through one day. I think it had to be like 2018, 2019. So I was in university and BuzzFeed had a video. So I checked it out. Woman born with a facial difference. I was like, oh my God, on BuzzFeed? Sweet. Like, I gotta check this out. So I watch it, and it's coincidentally enough a woman born with Cruzon syndrome. Okay, now I'm intrigued. Never seen this in my life on BuzzFeed. And so that led me into the spiral of the woman I ended up finding out, she's a advocate in the States, Ariel Henley. She's a twin. They're both born with Cruzon. So that led me, there's got to be something in Canada. Like, I got to find this. And that led me to AboutFace. And I went on their website and it had a little blob where you can add in your own story. And I ended up being the first story for Craniofacial Awareness Month, which is in September. And that changed my life. Just seeing positive comments on the post and just truly like has given me the opportunity to speak out and be confident, kind of like what Sarah was saying. Morgan, you were not, how were you quiet and shy when you were younger? Oh, I was. I kept it all into myself, and now I'm more confident. Faked it till I made it, and eventually you develop those skills. um, but it's really given me a sense of belonging. I always say, like, you have your friend group, you have your family, if you're in communities or extracurriculars. But I attended my first adult retreat, and normally they're in person, but it was COVID-19. And we all had, like, there had to be 30 of us. Everyone had a different, some of us similar ones. And it was just truly amazing to see the feeling. And I can't describe it. I never will be able to, but it's just this feeling of, oh my gosh, like I'm in a room, a truly safe space. I'm not assuming someone's, like Sarah had mentioned, someone looks at you, someone stares at you, you know what they're pointing. Um, I didn't have to worry about that. And so that led me into doing some campaigns, kind of like Sophie with commercial. I was like, well, this is fun. And I growing up, I was that cameras and photos, that those weren't my thing. But it just, yeah, it really gave me a sense of belonging, and it showcases supports that are available. Working in non-for-profit and the social service sector, the amount of resources out there that people just don't know about is quite mind-blowing. I call myself a resource finder, and even just reaching out to fellow, whether that's medical teams, community members, bugging your friends, go like the post AboutFace posted. Just it really just gave me power again and confidence to advocate for changes, like cosmetic surgeries being covered, and just too that if I ever have a child or decide to have children, it's a 50-50 shot they get the winning lotto like me. That I just want to be able to raise them in a supportive environment with the resources that I had growing up and as an adult. And so that's just truly has changed my perspective into kind of being in denial of that facial difference. It's just a medical term. Send me to the doctors. I'll come back, to growing into like truly loving this identity and the community that it's made me a member of. So has shaped me, I'd say, really positively.
Amazing. Amazing. Thank you guys for sharing. So my last question is, in what ways do you think awareness and understanding can be improved regarding facial differences among peers and medical professionals? And what is one thing that you want medical professionals, people outside the community, what is one thing that you want people to know about facial differences? So again, Sarah, I'll go back to you.
Oh man. Oh, you had this question written down and I've been thinking about it. I'm like, I've really been thinking about this question because it's a good one. And I think mine like it's hard to say. It's like, okay, I'm one person in this community and it's like this is my opinion, so I'm not sure if it resonates with other people, but usually it does. So let me take a shot. I think the biggest thing with me, and we all kind of touched on it a little bit, is like one of the biggest misconceptions that I've, faced forever and still do is that I hear people even say like, "Oh, you had a cleft lip and palate." I'm like, "No, I have one." And they're like, "Yeah, but you had your surgery." And it like that always bothers me. I'm like, "Which one you talking about?" You know what I mean? Like it's not a one and done. It's very much like you've got that iceberg and there's so much underneath because it's like, for me, it is that, psychological portion that I really struggled with. Whenever I went to a doctor's appointment, I wanted to rush out of there as quickly as possible. Um, like I didn't want to talk about anything. I remember I did have a social worker named Heather at the Hospital for Sick Children in Toronto, and she had a cleft lip. And I remember I was like in awe of her. I'm like, wow, first person in the universe I'd ever seen with it. I was like, oh, this is like a successful, amazing, beautiful, confident woman. I think I was like 13, 14 at the time. But again, like as like Sophie, I'm in awe of you hearing like that you want it. You're like, hey, can I talk about this? And I'm so sorry. Who would say no? But anyway, that's another, I'll stew about that later. Because, but I was so shy and I just wanted, I pushed everything down. And so I think one thing that I would want, the medical community to know, or like, I would have loved to be maybe encouraged or pushed a little bit more to talk about it and to be okay sharing. Because my whole thing was, oh, it's not that big a deal. It's not that, oh, you had like braces? Cool, so have I. Like mine was very much like, oh, you're just the same as everyone else. Whereas like, I don't know, I still get people being like, oh, wait, you have a hole on the roof of your mouth? Tell me about it. And I still get a little bit like, oh, well, it's not that big a deal. And I'm like, what am I doing? Like, I'm allowed to be proud about it and be like, oh, yeah, yeah, I do have difficulty, this, and that. So it's like, yeah, moving past the the braces and the surgery and going into that like deep down, like, okay, don't feel guilty, don't like shy away. Like let's explore like the psychological aspect completely. And like if the person's really shy to do so, give them a little bit of encouragement so it can happen earlier. Like this confidence that we all here have. Like it's just I'm like I could listen to y'all TED Talk for hours, you know. Um, but I would have loved to have that feeling so much earlier. Yeah.
Amazing. Yeah, no, and I hear people say that a lot, and like, not that this is about me, but I didn't meet anyone else. I met my first person with Mobius syndrome, which is what I have. I didn't meet anyone else with Mobius until I was 19 and I went to a conference. But before that, like, didn't know there was anyone else out there. So I think it's this is why things like this are really important and for connection and um and kids knowing early that they are not the only ones out there. So, um, anyway, that's my that's my ramble. Sophie, same question.
I'm the kind of person who loves awareness. There's a lot of people that I met in my life who needed awareness. And just recently, this summer, I was in a summer camp for theater. Because I go to the same place for the past 2 years. And there's this little kid, right? I saw him staring at me. So I go to my friend. I'm like, hey, do I look weird? It's showing my teeth. And this kid's like, you don't look weird. You look normal. You look normal. And I'm like, I get it. And then in the next 2 hours, he's following me. Just because you have facial condition doesn't mean you're weird. And I think the saddest part is he's like, people make fun of me too because I'm mixed. And I almost started sobbing because this kid, like, obviously, like, two different things. I have facial condition, he doesn't. But we've all been through, like, us both have been through kind of like bullying because of stuff we cannot control. So I love awareness. Something that I would like nurses and doctors to know. Well, I'm gonna go back to like back in '08, I was still in the womb. My mom actually kept a journal for when she was pregnant with me. It had like stuff because like I had like some kind of like fluid around my lungs. And so the doctor said like, oh, the kid's not gonna have any birth defects, no nothing. I came out with two. Maybe be a little more educated on the matter. So that's all I gotta say. For the journal, like evidence in there. And my mom decided to leave off on a cliffhanger because I was a premature baby. So that is all.
Amazing. Thank you, Sophie. I appreciate, I really appreciate, yeah, you talking about this. There's a lot of things that, um, we as a society need to, you know, um, take control of. So again, I appreciate you. Morgan, go ahead, same question.
And so, kind of similar to Sarah and Sophie, for me, I think what I would love medical professionals can improve on. Personally, I don't think it's anything like it's super negative. I've had my negative experiences, but I look at it more as like we're all, even if we were the best at something, we can all improve on something. And you don't have to necessarily do this to every interaction you have, but if you can change one perspective or one interaction, I think that would be the perfect way to go. So we can always be better. Knowledge is greatest power. No one can take knowledge away from us. And I think too, people look at facial differences, at least how I feel it, like as a life sentence. There's a lot of pity around it. And I think a lot more medical professionals can bring a level of cultural sensitivity and empathy. One example I like to share is from a negative to going just to get a refill on birth control. My doctor wasn't in, and I went in waiting for whoever doctor to come see me. Gentleman walks in, doesn't say anything, but did you know your eyes are protruding out of your face? Hello, hi, my name is Morgan. Who and you are you are who? Doctor so and so. But did you know your eyes are protruding out of your face? And I said, well, yes, sir, I do know that my eyes are protruding out of my face. It's called Cruzon syndrome. It's on my file. I'm not expecting you to know what Cruzon syndrome is. A quick Google search would have given you that. But that's what it is. And then he kept saying, but like, why? And I sat there and I was like, I could take a time to advocate my story and teach a lesson. I said, but the level of disrespect and you didn't ask me the way you would want to be asked. And I ended up saying to him, I said, I'm just here for a refill on a prescription. And I'm going to walk out and you can tell your boss why a patient just walked out. And those type of experiences for me, yes, it impacted me, but I think I'm in my journey of being confident enough that I can say, okay, just won't see that doctor again. But if that was something as a teenager at the children's, I don't know where that would have led me. And to reflect on the positive experiences. I had Chiari malformation surgery when I was in grade 6, and I see my neurosurgeon, Dr. Hamilton, every so often to keep making sure we're all okay. And growing up too, one thing I would say is incorporate the child into these discussions. I felt like Cruzon syndrome, okay, I'm here next. My parents are making those decisions. But when I got older, I became super curious. I wanted, I'm wanting like the ancestry DNA type of thing. And when I went to my one checkup, I think I was about 24, 5, I was like, hey, Dr. Hamilton, like what Chiari malformation did I have? And he was like, oh, malformation one, super common amongst Cruzon patients. That alone, I just felt, I was like, wow, when the whole time I'm the one educating people. I'm the one saying, well, no, that's not what was happening last time. And I really think like ask questions if you're curious. That's totally cool. But ask the way you would want to be asked. What the hell's wrong with your eyes? Well, okay, I'm not going to give you the time of day. Or, hey, you look different. What's up? Okay, well, I was born with a facial difference. And one thing that inspires me is don't take the little ones for granted, especially when they get those diagnoses. Because, kind of like what Sophie says, I used to spend so much time getting approval from adults, where I kind of shift it now to kids because I'm like, they're our future. It's representation. When you have books, when you have resources, when you share AboutFace, a simple the Frankie and Pearl video, like how cool is that? Share those resources with your neighbors, any kids. For example, the police service, they were looking for family resources, and I said, I'm going to send AboutFace. Don't know if you'll ever get a kid with facial difference, but just in case. And it's really just even checking in with the parents. My parents were so lost. They never knew how to navigate it, let alone how to support a 13-year-old teenage girl going through even trying to understand. And I think if you can bring that in, and I mean, I'm not a doctor or a nurse, so ethics and stuff like that, but if you can incorporate a child more into their diagnosis and understanding of how they're doing and how they're accepting that identity, I truly think we would see a much more positive cultural environment in society. And I think too, having a nurse or a doctor who just brings that level of empathy and kindness. Don't get me wrong, I do like a dark humor bedside manner, but those doctors I find are just those ones stick with me more in a negative experience because at that moment when I was scared or I was going under with anesthesia, I just want to a level of it's going to be okay. And I think too, like address it the way you would want to be addressed or to your children or your friends. And I can't say it enough, just share those resources. Because for me, I went to the Children's Hospital, Alberta Children's Hospital, and had no idea about Face. And I mean, that was something I would have loved to have as a kid. And I think too, just being able to connect on a personal level, of course with boundaries, but yeah, just bringing that extra level of empathy to your appointments or whatever situations you may experience. So yeah.
Amazing. Amazing. Thank you, the three of you, for sharing all of this. All of what you shared is really, I just thank you for opening up and for sharing this connection. It really means a lot. So thank you to the three of you. And again, I do appreciate it a lot.